Is your child having side effects from ADHD medications? Then watch this video and I'll explain it to you. My name is Dr. Nate Noble, and I want to welcome you to the channel where I give you 20 years of medical experience for 10 minutes of your time. That's a pretty good deal. In this video, we're going to cover the 4 most common side effects of ADHD medications. And in order to keep to my promise of keeping this less than 10 minutes, I'm going to cover what you do about those side effects in the next video. I'm going to link some previous videos up here for you to go and watch. Those videos, I talk about the neurotransmitters that are involved in ADHD medications or stimulant medications. And those 2 neurotransmitters are dopamine and norepinephrine. And they're involved with pleasure, flight, or fight. Okay, so the fight, flight, and pleasure neurotransmitters is what we're talking about. And those neurotransmitters are manipulated in ADHD medications. And so when you manipulate those medications, the side effects that you struggle with or experience are going to be in line with how those neurotransmitters work. Again, watch those videos and they'll explain it to you. Let's get started. So the first side effect that we're going to discuss today is appetite suppression. Appetite suppression, listen, it's if your child is put on an ADHD medication, it's not if they're going to have appetite suppression, it's when they're going to have appetite suppression. It's a given, it's a guarantee. I have very few kids in my clinic, that don't have this problem. And let's talk about why. Remember, dopamine and norepinephrine. Dopamine's your pleasure hormone. You're on a roller coaster, you're riding a jet ski 80 miles an hour, you're laughing at a joke. It's unlikely that the next thought you have, you're going 80 miles an hour on a jet ski. You're not going to lean over your shoulder and be like, hey, after this, let's get a hamburger, I'm super hungry. So nobody says that, right? The same thing when you're being chased by an assailant, right? So somebody who's trying to rob you, let's say. You're in an alley, there's water dripping, there's puddles, it's poorly lit. You don't know why you're there, but in the story, you're there. And somebody comes up to you and says, hey, give me all your money, and I want your money because I want to go buy some nachos. It's unlikely, because of the dopamine and norepinephrine that are shooting off in your brain, more norepinephrine in this scenario, the fight or flight, it's unlikely that you're going to say, hey, I got a solution. How about you and I both go get nachos because I'm hungry too? Unlikely, right? Because your norepinephrine is firing and your brain is in fight or flight. You're not hungry. When these medications work, okay, your child is focused. And they're going to be focused as long as the medications are effective. It's unlikely that they're going to have a desire or drive to eat. Now that comes back, and again, I'm going to talk about what we do about this in another video, but you have to know first and foremost that your child's appetite suppression will experience appetite suppression. Their drive to eat will go down. You'll pack them a lunch. It'll be a beautiful lunch. They'll have some yogurt in there, like some fresh raspberries and a banana and a little sticky note that says, I love you so much, here's a cookie. And they'll come back and none of it will be eaten. It'll all just be like there. They'll like lick a banana and that's it, okay? That's okay. Listen, that's okay. We're going to figure it out, okay? I'm going to talk about it with you. It's going to be okay, right? But understand that that's a part of the problem. And it's not that they always have to lose weight on an ADHD medicine, but oftentimes it's just that they don't gain weight at the same trajectory, like their growth chart kind of has to reset. Okay, second most common side effect of ADHD medications is sleep problems, right? As you can guess, if your dopamine and your norepinephrine are firing, you're on a jet ski, you're on a roller coaster, you're being chased by somebody with a knife, it's unlikely that you're going to say, when this is over, I'm going to take a nap because I am tired of running from you and I want to lay down. No one says that, okay? So children who continue to experience the active, the working of ADHD medications late into the day and into the evening, oftentimes they can't initiate sleep onset in a timely manner, and there are things that need to be done. Number 3 is irritability. Now this goes against some of the things you might think of when it comes to ADHD medications. You think, well, aren't these meant to subdue people? Like, don't they kind of take you down a notch, draw you in? Well, we're going to talk about that with the next side effect, but most of the time what happens is individuals, as the medications wear off, okay, they can become increasingly irritable. Think about a plane that's trying to land at an airport, but the landing gear doesn't come down. The plane's going to land, but it's not going to be a smooth landing. And that's what I tell families is like, listen, there's going to be some sparks. There's going to be a moment every day where people got to put their seat backs up and their tray tables in the upright position. Strap in. It's going to be a bumpy landing, but you're going to get there. So every day depending on the nature of the medicine and the kind that you're on and the length of action, there's going to be a moment where the medicines wear off and there's a step off, and sometimes that step off creates a little bit of irritability, sometimes a lot of irritability, okay? So I'm hungry now and I've got these headaches. I haven't really been taking care of my body during the day. Maybe I haven't been eating well. I haven't been blinking my eyes a lot because I've been so focused. The medicines aren't really affecting my dopamine and norepinephrine in the same way. I'm kind of like, my brain's kind of foggy. I just don't want to be messed with. I'm frustrated. And sometimes kids come home from school and they become irritable. Very, very irritable. And again, I'm going to talk about it, but that's a very common side effect because the medications don't work and their brain is trying to kind of regulate itself again, and that creates some difficulties. Okay? Sometimes kids don't get irritable at the end of the day. I had one subscriber ask me about irritability in general, which is a great question, by the way, and thank you for asking it. And if you have questions, ask them. Put them in the comments. I'll get at it, okay? I mean, I'm giving you access as best I can. Now, if I get 10,000 comments, okay, I'm probably not going to be able to do that. But I got 13 subscribers, so I feel like this is pretty manageable. Okay? But I want you to receive that, okay? And know that if you got a question, if you got a video that you want to see, put it in the comments and I'll take a look at it, okay? So that's the third most common side effect, okay? Irritability. Now, but one of the subscribers, getting back to what I was saying, one of the subscribers asked about irritability that they were experiencing, that their son or their child was experiencing. Sometimes it's not just at the end of the day. Sometimes it's irritability right away. These medicines work within 30 minutes. So you take a medicine for ADHD, if it's a stimulant, the day you give it is going to be a different day. It is going to be a different day. Now listen, in our clinic, I say, listen, here's my goal with ADHD medications. You're either going to love them or you're going to hate them. But you're not going to be indifferent. No one's going to go like, I don't know, do you think it's working? I don't know, what do you think, honey? I don't know, what do you think? I love you guys, but listen, we are going to push those medicines and we're going to push those doses so that we can get to a spot where we either love them or hate them. And you're thinking, well, I don't want anyone to push medicines on my kid. Neither do I. Neither do I. But if I'm going to partner with you in the manipulation of your child's neurochemistry, it better work. We're not messing around. No one's licking a medicine here and be like, oh no, it doesn't work. It's not doing anything. We're going to do it, right? We're going to optimize the dose. But sometimes kids, because the medicines are so potent and they work so quickly, sometimes kids just aren't good candidates for stimulant medications and they activate right away, right? There's something about the way that their brain interacts with these medications and the manipulation of those neurotransmitters that causes them to be increasingly irritable. And that's what I call activation. When a child activates on an ADHD medicine, we stop it. We stop it. We either decrease the dose, try a different stimulant medication, or we stop it altogether because the juice is not worth the squeeze when that's happening. The last side effect is zombies. Zombies! I bet I heard it 1,000 times. Well, I'm not going to put my kid on a medicine because I don't want her to be no zombie. I'm like, listen, zombies drag a leg. They have poor dental hygiene. They eat brains. I don't create that. I've never seen a child do that. I've never even seen that. I don't feel like that's a logical outcome of ADHD medications, okay? But what you're talking about is not zombifying somebody. You're talking about somebody becoming withdrawn. Now listen, spoiler alert, I got me some ADHD big time. All the medicines that I've been talking about, I've been on. I've been on all of them. Do I take it now? No. Should I? Yes. But I'm not, okay? So I know how these medicines make people feel. And the zombified, the zombie type experience, it's not sedating, it's withdrawing. A child is being withdrawn. They're gone inside. They're just doing what's in front of them. They're not being a part of the thing. They're not being a part of the joke. They're not being a part of the activity because they're just so inside themselves. Listen, ADHD medicines take a very lateral, kind of a lateral reality where kids can move this way, they can move this way. They take a lateral environment and they make it kind of a one long dark hallway. Okay, and at the end of the hallway is an exit sign, and that exit sign is when the medicine stops working. It's a 4-hour hallway, a 6-hour hallway, a 12-hour hallway. Your child can try all the doorknobs they want. They're all locked. You stay on this hallway, you march to the end until the job is done. And anything you put in front of these kids, most typically, if the medicines are effective, they will do. Listen, if anything about this has been helpful, like and subscribe. Like and subscribe, because listen, if you don't, nobody identifies, the algorithm doesn't pay attention to me. I'm over here waving my hands trying to give good comment and the algorithm's like, whatever, Noble, you're dumb. If you like and subscribe, the algorithm sees it. You don't even have to like it. You don't even have to want to subscribe. Don't worry about it. But it helps get this in the hands of people who really need to hear this stuff. Otherwise, you're relegated to a super long wait list where you're going to have to wait and meet with somebody who you might not even like. And it's going to cost you a copay. What's your copay here? $0. This is a $0 copay service. It's just me and you in my basement. Okay? So like and subscribe. More videos to come. Thank you so much for watching.